If you follow sports at all, you know that this past Sunday, Cam Skattebo suffered what was likely a season-ending injury regarding his ankle. I just want to come on here and kind of talk about what I think happened based off what I've read about and what I saw from an orthopedic surgeon's perspective. So you can see in that video, Cam's ankle rotates and turns over, and he suffers from what's called a rotational ankle injury. Now, this is a broad name for a lot of different injuries. On the smaller side of that scale, you've got just very basic ankle sprains, and on the more severe side, which is unfortunately what Cam experienced, he had an ankle fracture dislocation. I haven't been able to find exactly what happened, but from the sources I've read, it sounds like he broke his fibula, which is the small bone on the outside of your ankle, as well as tore the deltoid ligament, which is this big, beefier ligament on the inside of your ankle. And this is actually a very common pattern for rotational ankle injuries. After something like this happens, the kind of most important steps to take are to get the ankle reduced or pop it back into place to alleviate any of the pressure or any of the forces on the soft tissues around it to make the surgery easier going forward. After that, because he suffered one of the more severe rotational ankle injuries, he's definitely going to need surgery to recover from this. Now, after the OR, if everything goes as planned in the operating room and in the post-operative course, you can normally expect for patients not to be walking on these for at least 6 weeks after surgery. Every surgeon is a little bit different. Sometimes they get people back sooner, but in general practice, probably about 4 to 6 weeks of non-weight bearing to this foot. Following that, there's also a buildup in return to sport. You can't just go from not walking straight back into playing football. So because of this, Cam probably is out the rest of the season. However, with the right team of doctors, nurses, and physical therapists to get him back, I fully expect Cam to make a full recovery and be back for next season. So that's kind of what happened with Cam's injury. Let me know if this interests you or if you want to hear more about this. I'm really into sports. I'm really into orthopedics, so I'd love to tie this in more. And let me know if you guys have any other questions.